All right, Meiram, let's talk about, let's say you're a listener. Let's say you think something is wrong, or at least you've discovered something's wrong. You need treatment. What's the simplest first thing you should do? And what's the list you should make?
Well, certainly try to enlist the help of your provider. Usually,
We've already said that doesn't work. So.
well, if that doesn't work, if you can't get some additional support from your provider, you want to start the appeals process.
Right.
So you definitely need to exhaust your appeals with your insurance carrier in order to be able to make claims down the road.
And this is another thing that amazes me about the health insurance situation and insurance in general is that you don't go to a court anymore. They've have regulations that allow them to internally create their own judicial system. So normally you have legislative, executive, and judicial, and those powers of government are supposed to balance each other out. But with the health insurance, they get this exemption because they're covered by state insurance commissioners that they don't have to be sued until 3 appeals internally with what are called administrative law judges. And so that you can get turned down until finally someone that really has the power to enforce something against the insurance company then says, "Oh, okay, yeah, you get your benefits."
It's such a pain.
It's so frustrating,
Yeah.
Yeah, it's
isn't it, for
unbelievable.
people? That's why you're here. I mean,
Well, that's a hurdle, especially in the Medicaid markets, where you have to go through extra hoops. In the private commercial markets, it's usually 1 or 2 appeals, and then you have the right to sue.
But normally, just filing is hard enough for someone who's sick.
know.
Absolutely.
Right?
People throw up their
if you're
hands.
mentally ill, think about what it takes just to even file once.
If you're in the hospital, how are you going to file it? What, you're going to have a bedside fax?
Right, and then
if
then you get denied, then you become hopeless, and sometimes people will kick you out of the hospital.
Yeah.
And then what are you supposed to do? Then you're even sicker, and so
It's a cycle.
it's really criminal in a lot of ways. What the expectations that are placed on people that are ill, and this goes for physical illnesses as well, not just mental illness.
Well,
the insurance companies put the burden they put on you just to get the treatment that you deserve and you've paid for.
And they rely on stigma
Yep.
to keep you quiet.
Right.
But that's why all the more it is important for people to get their providers to support them, whether they're individual therapists or facility providers. Usually hospitals and residential centers, they have large staff, so they're equipped to help.